So let's get started. Today we're going to talk about our Medi Tresse hair care line and the Tresse RX supplement line. So welcome. I'm going to be here every Wednesday for the next couple weeks around lunchtime, 12:30 to 1:30, to discuss just different topics over the next few weeks. This is our agenda for the day. So we'll just give you a little bio on myself. We'll talk about some office updates. We'll talk about female hair loss. We'll talk about the Tresse RX supplements and topicals. And then we'll talk about our new hair care line. And at the end, we'll save some time for questions and answers. So my name's Sarah Moresco. I'm new to Medi Tresse. I joined this past October. I have been a nurse for about 10 years and spent my first 8 years working at Mass General as a nurse while I was finishing my NP degree working in the ICU there. I ended up kind of getting experience with aesthetics, injectables, and now PRP hair restoration. So I've been doing that for the last 5 years. And I'm happy to be a part of the team. So a few office updates. We have some new safety protocols in the office going on. So our number one priority is the health and safety of our patients and our staff. So we've been kind of closely following and in many instances exceeding the protocols that are recommended by the CDC and the Massachusetts Department of Public Health. So we've kind of started limiting our number of staff in the office at any one time, staggering appointments, so there's no kind of much decreased foot traffic with patients. The appointments are, like I said, spread out to minimize any patient-to-patient contact interactions and just to allow for additional time between appointments to sanitize rooms. We as staff members wear masks at all times, and again, all of the rooms here now have air purifiers, so we've been super safe and making sure we keep everyone safe. We do have some kind of advanced screening options for COVID, so we're ensuring anyone out of state, if they're traveling in, we obtain COVID tests and have pretty strict temperature checks and COVID screening forms that we have everyone fill out, including for staff every day. So we're kind of trying to push any video options for consults or follow-ups. If anyone is hesitant to come into the office, we're happy to do consults over video if you're not comfortable coming in for any treatments. And then we do ship products all the time to make sure that you're getting your continued treatment throughout this time. And we also have our Medi Tresse online store that's available. First, we're going to talk a little bit about female hair loss. So we'll start with talking about the hair life cycle and different types of hair loss and then types of treatments for it. So this is a diagram of the hair life cycle, and we'll then talk about the types of hair loss. So this is the three kind of phases of a normal hair life cycle. The first is the anagen phase, which is known as the growth phase. This can last from anywhere to 2 to 6 years. In this phase, the hair is recovering, receiving all of the nutrients it needs, and this is in the anagen phases where the hair is actively growing. One of our treatment goals here is to prolong this phase. The next phase is the Catagen phase, which we also call the transition phase. This can last from anywhere from 2 to 3 weeks. Here, essentially, there's no further growth happening. The follicle will start to detach from the natural blood supply. And then the telogen phase is known as the resting phase. This can last from anywhere from 3 to 4 months. There is no actual growth here. This is the what's considered the shedding phase. So over time, due to genetics, it's possible for the entire hair life cycle to shorten. And this is what we see often in our most common type of alopecia, which is androgenic alopecia or female pattern hair loss. So this is an inherited type of hair loss. It's the most common. and that's a non-scarring, under the umbrella of a non-scarring alopecia. The next is a telogen effluvium, which is kind of, could be described as an excessive shedding without a lot of regrowth happening. The next is a traction alopecia, which can be from different types of hairstyling techniques. And then alopecia areata is just really kind of described as a spotty, bald spots that can come and go. They wax and wane. The scarring alopecias under this umbrella include frontal fibrosing alopecia, CCCA, and LPP. These are more difficult to treat. This is where the hair follicle actually gets damaged. So we'll talk about all of these in different segments. We also treat hair loss as a result of cancer therapy, and we'll talk more about that. So the time frame that the hair follicle stays in to each of these phases will kind of determine how much shedding is occurring and how much regrowth can occur. So treating female hair loss. The first step is in treating hair loss is finding out what is the cause of the hair loss. So when you come in for a consultation, we do a thorough medical history. We'll do a thorough hair loss history. We do a physical examination. We look at your hair under what we call trichoscopy. So it's a magnifying device, and just check for any signs of specific things we look for with different types of alopecia. And then blood work and biopsy are big on our list too. We pretty much try to get blood work on everyone. This is to make sure that, you know, the person is nutritionally in good shape and to see if there's any underlying deficiencies that we can treat from the inside out. Biopsy, we would do in ruling out certain types of scarring alopecias or things that we just can't officially confirm. We maybe don't like what we see on the trichoscopy, the magnifying device, so we'd go ahead with a biopsy and figure out exactly what's going on. So in general, the treatment plan varies greatly depending on which type of hair loss the patient has. What we're going to kind of focus on today are some of the at-home treatments. So these are vitamins, supplements, topical treatments, and then our new line of shampoos, conditioners, and deep treatments. So this is our Tresse RX line. It includes the Healthy Hair Inside Plan, which is the fortifier, the prebiotic, and the revitalizer. It's a 3-step process. And then we have our Healthy Hair Outside Plan, which is the Tresse Root Cleanse and the Tresse 3X Serum, and we'll talk about all of these. So the agenda for the Tresse line, we're going to talk about how and why we developed this protocol, what makes it effective. We'll break down each supplement, and then who would be the ideal patient for these products. So the protocol was developed after a lot of research. So we're constantly evaluating new research, new treatments. We felt that our current treatment options were missing 2 important kind of treatment options. So one was an in-home microneedling option. A big problem was that a lot of people were using more of the roller instead of using an actual microneedling cartridge device. The rollers don't penetrate the skin, so there's really very little absorption. And then the second focus was on gut health. So there's a lot of research that's showing the important role that gut health plays in hair health. And after kind of extensive research that was done throughout 2019 and early 2020, we kind of zeroed in on these 2 topics and 2 products. So what makes our line effective? As we know, that female hair loss can be very complex. So for many women, there's more than just one thing going on that's causing their hair loss. It can gonna be a combination of genetics, stress, nutritional deficiencies, hormonal imbalances, scalp and follicle health. So our line is a multi-therapy approach. It focuses on all these potential factors that will give you the best chance to regrow hair, decrease shedding, and overall rejuvenate your hair. Big #1 goal of ours is to stop the loss from getting any worse and decrease shedding, thicken hairs if possible, and then always to regrow hair if we're able to. It's kind of important to know that all of these treatments work together synergistically. So we'll talk about how all these kind of work together. So again, this is just kind of a breakdown of the outside program and inside program. The outside program is the microneedling stamp and the Tresse 3X serum in combination with a root cleanse shampoo. And then the Healthy Hair Inside program is the 3-step supplement process. It's the Prebiotic Gut Health, that's a powder, our Revitalizer, and Fortifier hair loss supplements. So the Healthy Hair Outside program, this is our topical healthy hair plan. It uses growth factors found in each of these vials. They are placed in a microneedling chamber, and you actually microneedle the areas where you're losing your hair. So these growth factors help to treat the cells around the follicle. They help balance the scalp microbiome and enhance the environment for healthy hair to grow. So this kind of gives a breakdown on the details of the 3X serum and the actual channel applicator. So you use this at home. Like I mentioned, it's a protein-rich serum. It has, blended with a lot of vitamin B and plant extracts that kind of help to condition the scalp that allows for optimal hair growth. So the key ingredients are a lot of growth factors. I won't necessarily go through them all. One is a keratin type growth factor, along with a biotin growth factor that's a complex protein. Research and studies have shown that epidermal and fibroblast keratin growth factors can help promote thicker and healthier hair. This comes with an easy at-home applicator. Like I mentioned, think of it like microneedling to the face, but to your scalp. So it helps increase absorption of the serum much more than a roller would do for you. The rollers aren't going to really necessarily help to absorb like the microneedling chambers will. So each at-home treatment kit contains 4 vials. 1 vial contains 1 treatment. So the way it works is we have you use 1 vial, which is 1 treatment per week. A minimum of 3 to 4 cycles is recommended for the best results, and a cycle is defined as a 30-day period. So you'd essentially use 1 vial once a week for the month. The Tresse Scalp Cleanse Shampoo, it's a sulfate-free cleanser. It helps kind of prep the scalp prior to applying the growth factor serums that I just mentioned using pre and post procedure. So it's really a prepping shampoo intended to use prior to the microneedling chamber, the 3X home treatment. This helps with increased absorption and it really improves treatment results. This can also be used as a weekly deep cleansing shampoo, just good for kind of buildup or anything like that. We only recommend really using it once a week, however, because it's a very, it can be drying if it's used more frequently. So it's once a week to either kind of get rid of any buildup or in anticipation of doing the 3X home treatment. It's a high protein, multiple growth factor serum that's, like I mentioned, sulfate free. So this is our Healthy Hair Inside program. So this is the 3-step supplement series I had mentioned. So this consists of these 3 steps that start as a 6-week program. So this was created to kind of address total body inflammation through gut health, which is one of the things we had felt that was missing, and nutritional factors that may play a role in hair growth and shedding. So the kind of some of the important ingredients here are special marine botanical ingredients that are kind of the base of the product. They have amino acid proteins, vitamins to support this approach. That's really just kind of a overall complete approach to healthy hair, skin, and nails. We do recommend a minimum of 4 cycles to kind of start seeing results. So the way this works, and we get a lot of questions with our product line, is you take the middle container there, which is the prebiotic, and I'm going to break down each of these separately as well. But the prebiotic powder is used for 2 weeks, a scoop a day for 2 weeks. And then you'd add in the Fortifier and Revitalizer, which are the actual pill supplements. So it's 2 pills each of the fortifier, 2 pills each of the revitalizer. So you'd be doing a total of 4 tablets per day. The prebiotic is used for the first 2 weeks to really just prime the GI tract, increase absorption of the vitamins once you're ready to introduce those. After you do the 2 weeks of the prebiotic, we would then have you continue the prebiotic every other day, a scoop every other day once you start using the fortifier and revitalizer supplements. We'll talk about each of these separately. So here, the Prebiotic Gut Health. So this is a powder. It has a mineral-rich blue-green algae. It gives it its bluish-green color. It is proven to have anti-inflammatory botanicals, and all of the key ingredients are listed there. It's a very sweet tasting, you know, it's not a difficult supplement to take. It's just 1 scoop a day in 4 ounces of water for the first 2 weeks and every other day thereafter. And all the ingredients are listed here: the L-glutamine, spirulina, licorice, turmeric, aloe vera, beta-glucan, and piperine. So the Tresse Fortifier is our follicle enrichment supplement. It has a lot of botanicals, adaptogens, marine collagen, saw palmetto. These are known to support hair growth and help to block the conversion of testosterone to DHT. DHT is the byproduct of testosterone, and it's known to cause breakdown of the hair follicle. So saw palmetto is a big, important one in the fortifier to help reverse that process. This is designed to stimulate hair growth and decrease loss. So the key ingredients here, as I mentioned, are the saw palmetto, ashwagandha, resveratrol, and the marine collagen. And the fortifier is our kind of complex super B and biotin supplements. So the B complex and biotin are kind of known ingredients to promote conditions and support healthy hair, kind of keeping those hairs you have healthy. The big part of the fortifier is that the vitamin B complex, it's, you know, it's in its most reduced form, so it's immediately bioavailable, so you absorb it really fast without over accumulating. So the big ingredients here are complex vitamin B and biotin. So again, after the 2 weeks of the powder, you then start your revitalizer and fortifier. It's 4 tablets a day, 2 of each, 2 of the revitalizer and 2 of the fortifier. So a big question we get is, who would we recommend these products to? So before we recommend this plan to anyone, we would need to do a complete evaluation to make sure you're an appropriate candidate. And that's through one of our consults, either in person or online, as I'd mentioned in the beginning of the webinar. So patients that this is appropriate for would be anyone diagnosed with androgenic alopecia, which is female pattern hair loss, a Telogen Effluvium, and traction alopecia, all good candidates that make up the Tresse RX protocol. So for patients diagnosed with alopecia areata or scarring alopecia, we would need to kind of review them each individually to determine which treatments would be appropriate. It's a little bit more customized and for each patient. So if anyone has already had OPC, which is our optimal platelet concentration therapy, or PRP therapy, platelet-rich plasma therapy, or currently in the treatment plan or waiting for your first appointment, this isn't used in place of the injections of the OPC or PRP, but it's also used as an adjunct or in conjunction with our in-office treatments. So next we're going to talk about our hair care line. So this is new as of this year, 2021. We just brought this on, and we are loving our new products. So we have our Revive shampoo and conditioner, volumizing shampoo and conditioner, the keratin deep conditioner, and the hydrating serum. So we'll go through each of these. The Revive shampoo and conditioner, it's a stimulating cleansing shampoo, super moisturizing conditioner. It has peppermint, lavender, tea tree oils. It's known to stimulate hair growth and revitalize both the hair and scalp. While it really does create a calming spa-like experience, I personally have used this and I'm loving it. It really feels nice on your scalp. Your hair feels super clean and not weighed down, but again, super silky afterwards. So the lather of this shampoo kind of removes excess oils and product buildup, but while at the same time it helps to strengthen your hair and improves body shine. There's a lot of vitamins, botanicals that help protect the skin and scalp, and a lot of proteins that help to protect the hair shaft and decrease breakage. So the shampoo and conditioner are safe for color treated, any straightened, chemically treated hair. It's recommended for everyone except for patients with finer hair, and I'll discuss the options for them next. If you're concerned of products weighing your hair down, or you've had products weigh your hair down in the past, we would recommend going with the volumizing shampoo and conditioner instead, and we'll talk about that next. So the volumizing shampoo and conditioner, it kind of infuses more of a weightless volume, but it still frees the hair and scalp of impurities, so it's still super cleansing. It has a provitamin B5 that strengthens the hair, that adds shine and thickness. And it's combined with a volumizing conditioner that's infused with keratin. This leaves the hair really nourished looking and maximizes volume and body. Again, all of these are safe for color treated and chemically treated hair. And this is recommended for our patients who have finer hair, who's just looking for more volume, essentially. The Keratin Deep Conditioner is a great once a week treatment for anyone, any types of hair. It is, filled with proteins, extracts. It restores moisture, strengthens your hair, and reduces breakage and stops frizz. Again, safe for all types of hair. It's fine for fine hair, and a little goes a long way. We're recommending using this once a week. So our hydrating serum is an additional part of the line. So it's essentially Moroccan argan oil. This is fast absorbing, deep penetrating, and it produces a very luxurious shine. It makes your hair super silky and smooth, but again, doesn't give you that weighed down feeling. A little goes a long way with this, so it should last you a while. And again, safe for all hair types. So that ends our webinar. Again, we're going to be doing these every week and discussing different topics. So if you have questions kind of unrelated to today, feel free to ask them. I'll do my best to answer them today. We can always reach out to you via email to answer questions, but potentially there may be a webinar on your questions coming up. And also, we post our webinars online, so you'll be able to go back and re-listen to this if you prefer. And there's also webinars back from the spring that a lot of the staff had done on a lot of different topics, laser, PRP, OPC, supplements, things like that. So check those out on our website as well. And we will start taking some questions. Let me try to pull some up. So the first question is if I can demonstrate how to use the 3X microneedling. So I don't have, but I can just show you what it looks like. I don't want to open the package, but this is what the microchannel looks like. And it comes with these vials. So you just unscrew the cap, and you would put the serum in here, and essentially you would just stamp the microneedling chamber anywhere where you have hair loss. Mike told me to open it if I want to, so I will open it up and give you a better look here. So this is the chamber. You just attach this here. You would put the serum into the chamber once a week, 1 vial, and then you just remove the top cap here. It has little micro channels here. It's probably not a great picture, but you just would want to stamp it in and around any areas that you're losing your hair. Again, this is once a week for a month, so each comes with like a 1 week supply. And if the person who asked that question needs any further assistance, definitely email us at info@Medi Tresse. I'm happy to email you back or give you a call myself later today. So our next question is, how would you introduce the prebiotic if you're already taking the other two supplements? Would you just take every other day, or would you start with 2 weeks every day? I would start just taking the powder. I'd introduce it by just starting the powder every other day if you're already on the other two supplements. It's kind of to start the powder for the 2 weeks. We wouldn't want you to stop your supplements and go back. Essentially, this is really just to initially prime the GI tract, but it's going to help with inflammation. So adding that in every other day will be helpful. You don't need to do 2 weeks fully every day. Every other day should be fine. Another question is, the formula PM different, or were one of those the same as that? So the formula PM is different. So formula PM is minoxidil, 5% minoxidil. That is a topical solution. Today we just talked about our line of supplements and topicals. The 3X serum doesn't have minoxidil, which is essentially over-the-counter Rogaine. So formula PM is something that's used every night to help you apply it in areas where you're losing your hair. Our formula PM has a retinoic acid, so it helps to cleanse your scalp prior to the minoxidil. It helps to absorb it better. And it has less alcohol content compared to over-the-counter Rogaine, so it's usually a little bit more tolerable in the sense that it's less irritating to the scalp. That is the formula PM question. And how often would you need to repeat the cycles? I think you're asking about the Tresse RX, the at-home microneedling, is if what I'm gathering is right. So really we're recommending to be able to do that. Like I said, once a week, 1 vial is a 1-month supply. We'd really want you to do this. You wouldn't really start seeing results until a couple months. So we'd probably want to do at least a series of 3 to give you the best results. So it'd be basically a 3-month treatment. And you could repeat them. It's just, you could just start it the following week.